Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com and one of our fantastic True Health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 21.
So basically, adrenal fatigue is the most common illness that no one knows that they have and that naturopaths treat every day.
Well, it is a beautiful day. Spring has finally arrived. We're under a blue sky. The sun is going to set soon and surrounded by nature, by a pond and trees. And so, of course, we had to do the podcast outside today.
Yep, out in nature with the naturopath.
And exactly. Welcome back, Dr. Megan Saunders, to the show.
Thank you.
And thank you for deciding not to do this in the studio and instead doing it outside. We're going to kick our shoes off and do some earthing.
There we go.
Ground our feet. And
it's called Nature Cure. There's a whole tradition called Nature Cure. It's a European tradition of people heading to the health sanitariums and different practices with saunas and hot springs and also walking out barefoot. Father Knipe, one of the founders of naturopathic medicine, would recommend that for people. They'd go out and walk every single day barefoot, snow, rain, sunshine, get the dew on their feet, stimulate the nervous system because there's tons of nerve endings on your feet. And he might not have known that at the time, but that's kind of the prevailing theory now of why that was so beneficial for things like adrenal fatigue and the immune system and a whole bunch of other things. So.
Adrenal fatigue is something I want to talk to you today about, so that's great. What's really neat actually about Father Sebastian Knipe is I was telling my mother-in-law, who has a German background, about his story, and she said, when I was a child growing up in California, my grandmother, who's German, every morning, she was also her nanny, would take her out right as the sun rose, and they would walk across the lawn when it was still wet.
Mm-hmm.
Every morning.
That's it.
And she didn't know why. She just did it with her grandma, and her grandma did all kinds of things like that, like earthing and getting out in nature barefoot, which, we don't do.
Yeah.
So
rubber soles between our feet and the ground, and temperature controlled everything. And
right. When I lived in Vegas, I said, I feel like I'm in an ice box inside an oven. I was just moving from icebox to icebox inside an oven. I never felt like I ever connected with nature.
Yeah.
So I love living here in Washington. So we're outside in this beautiful day. So if you hear birds chirping.
Or frogs croaking in the background. I think I just heard one.
So yeah, listen for the nature sounds. To relax you, to calm your adrenals.
Right, yeah. So yeah, that's a good thing. That's an important part of adrenal fatigue is your state of mind and being able to relax and recuperate.
So what is adrenal fatigue?
Yeah, so adrenal fatigue is not a mainstream medical diagnosis. Unless you're seeing kind of a more holistic MD, medical doctor, you're unlikely to get diagnosed with this. There are a couple diseases that have to do with the adrenal gland, things like Addison's, but those fit within sort of a diagnostic box. There are some key markers that we look for on a metabolic panel and also on some hormones that would tell us, okay, you have this disease and you fit in this disease box. But lots of what we do as a naturopath in this profession is treating people that aren't necessarily in the disease box, although many people are, but also working on optimal health. So while you might not fit into the disease box, something's obviously not working right. And so with adrenal fatigue, what that is the adrenal gland is responsible for making several different important hormones and messengers in your body, one of which is cortisol. So cortisol is something that spikes when you're under stress. It also will elevate when you get hypoglycemic because it'll trigger the release of glucose from glycogen from your stores, your sugar stores in your body. And it will also, there's sort of a diurnal pattern with cortisol. And so what should normally happen is you wake up with cortisol high in the morning, you're bright-eyed and bushy-tailed, and then it goes down gradually throughout the day until around midnight when it gets at its lowest, and then it starts to go back up. And what we tend to see, so that's normal, right? That's what should be happening. And then when people go through stressors, whether it's you're in a survival situation with your community in the woods and you're running from a bear, right? Because that's the original thought is, okay, we're running from a bear or we're hunting or whatever, so I need easy access to energy, sugar. I need to be able to respond to the stressful situation, and that ideally shouldn't be happening all the time. So in our sort of modern Western society, a common issue, and I'm seeing this more and more even with kids and teenagers, is we're always running from a bear. There's always something stressful. People are always overstimulated. And so cortisol levels get out of sync. And so what happens is so you imagine that if it's a situation, there's a family member that's ill, right? That's that sort of situation where it's go, 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 go. People normally power through, and it's a really common story. They say, and then after that issue resolved or it was done, then I got sick or then I got tired. So that's sort of what I tend to describe to patients as the first stage of adrenal fatigue. Another example of that would be the college student that is staying up all night to study, high energy, maybe a little bit of anxiety, just kind of overall high levels of cortisol. And sometimes there are going to be sleep issues along with that because they're overly stressed and overly stimulated. And then the next stage is you've been doing that for a while. Whether it's because you were a high-achieving high school student and then went to college and just that alone was enough to do it, or a mom that had a new baby and the baby's still not sleeping through the night and it's a year and a half, or whatever that thing is that was the acute stressor now has become something that was chronic, or is a pattern that has developed now towards all stressors. And so then what happens is it's like a car misfiring, right? So sometimes you'll go and it'll be high energy, and these are the people that say they can just kind of power through when they're feeling tired, and then they crash. And sometimes sleep issues are still a part of that. Anxiety can be a part of that because of the overstimulation. Those are people that often will say things like, it's hard for me to turn my brain off to go to sleep, or they'll wake up in the middle of the night and they'll just be alert. Just one of those, you open up your eyes and you're just awake sort of situation. And then the third stage is the I'm just tired stage. And most commonly I see that with people in their sometimes in 30s, but more often in their 40s and older. So they've been working, they've had kids, they've been doing a lot of things for a long time and powering through, and they can't power through anymore. And so that is fatigue throughout the day. I'll often say, do you wake up feeling tired? And sometimes people will say no, and then I say, how many cups of coffee do you have? Do you feel human? If you don't have your coffee, normally that's a tell as well if you're using stimulants to get through the day. And then also, if you could take a nap in the mid-afternoon, would you? That's another sort of tell of just sort of energy crashing. And then the sleep thing, even with that I'm just tired stage, there can still be the anxiety and stress. And what happens, if you imagine sort of that curve that I described of, your cortisol should be high when you wake up in the morning, lowest at midnight, is it can get inverse. Or there can be spikes in it. And so when we do salivary testing, saliva tests for hormone levels, which is the easiest way to do it at home. You could do blood tests as well, but probably not going to be very accurate if I send someone to the lab at midnight, and I doubt the lab would be open anyway. So I do saliva testing for that. And lots of times we'll see cortisol levels being very high at night and just crashing in the middle of the day. And that's someone who is exhausted and can't sleep and doesn't get rejuvenative sleep. And so that's kind of the third stage. And what I often do and find is that oftentimes people don't just fall into one category. So someone might be overly stimulated at nighttime and need something to help calm down the adrenals and help them sleep. And then during the daytime might need something really stimulating. Something like licorice root is something that's very good for that. It extends the half-life of your endogenous, your natural cortisol by preventing the enzyme that breaks down cortisol from doing that as effectively. And so, and also things like ginseng and other very stimulating herbs, so building you up during the day and then kind of tonifying you down at night. And that's for that person that has that inverse scale of their cortisol being flipped. Another important thing for that is, as I described earlier, cortisol has a relationship with blood sugar. And so very commonly what I'll see with people with adrenal issues is that they're also dealing with either they're already diabetic, but more commonly we're looking at their labs and they're trending in that direction, and they'll have the sort of story of I'm addicted to sugar, I'm addicted to carbs or whatever, some, you know, that sensation of I just need something. And so what tends to happen with that is they're getting low blood sugar, they're getting hypoglycemic because they're not eating either high quality foods throughout the day, so it's just spiking and then crashing, or they'll wake up and have coffee and then not eat until 3 or 4 because they're just busy throughout the day. And so then it becomes this chicken or egg situation, you know, is your blood sugar off because your cortisol is all wonky, or is your cortisol off because of the blood sugar? They both can trigger each other to become imbalanced. And so that's often something that will play a role in that as well, especially for that nighttime waking that I described. One of the things, besides using herbs like ashwagandha, which helps prevent cortisol from spiking, I'll also recommend that people will eat protein, especially if I see on their blood work that blood sugar is an issue, that insulin resistance is an issue, that they eat some protein before bed. And then that will help prevent the blood sugar crashing in the middle of the night. And then with the herbs to help the cortisol be balanced, that's a general part of the plan. So basically, adrenal fatigue is the most common illness that no one knows that they have, and that naturopaths treat every day. I mean, it's every once in a while I'll get a patient and I'm shocked. I'm like, wow, no adrenal fatigue. You are a miracle. But for most people, if you've got a job, if you've got kids, if you're living and working in our society, unless you've got a really good self-care practice, it's hard not to have that build up over time and to get those stress hormones out of balance.
I think looking back in my life now, I actually remember in college, I'm Canadian, so I'd go to Tim Hortons, which is our sort of like Starbucks and Dunkin' Donuts all thrown together. And I would not feel human until I had my extra large 4x4, which is four creams, 4 sugars, largest coffee you got. And, you know, my friends and I had this joke, like, just give it to me intravenously.
Right.
We just start slapping our vein, just like, here, they'd say, how would you like your coffee? Like, just right here, just put right in here. All my friends, we needed coffee. And this is when we were in college. And then, of course, I didn't eat breakfast. I just had a big sugary coffee, skipped breakfast. For lunch, I couldn't even make it to lunch. I'd hit the candy bar, machine.
Yeah.
And in my mind, I'm going, you know, I got to study. I got to go to this class. Oh, my friend has a party. And it was just go, 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 go. And I remember pulling all-nighters and not taking care of my body at all.
And when you're young, you can kind of power through that. Lots of people can. You know, you can pull an all-nighter and then sleep the next day and not have it affect you the way that someone who's in that third stage of adrenal fatigue that is just exhausted, that can wipe them out for a week. They can't do it. They physically can't do it. Or if they do, it really affects them quite severely.
Right. And just years of doing that, I went further and further into exhaustion. And to the point where when I woke up in the morning, I couldn't even hear people. I could not understand people. I had to get tons of coffee into me before I could even function. And I actually did the saliva test back in 2008 or something like that. I had a really cool doctor who was a holistic minded medical doctor who said, let's do this saliva test. And so I spat into these little tubes all day long.
Right. Yeah.
And she said the highest my cortisol ever was at 9 o'clock at night, and it was still so low it would be like what a normal healthy person is just waking up in the morning or something. It was something. The scale was completely anyways, it's what you described with the scale being totally flipped, and so but she did not know the herbs that you'd mentioned. You know, she said, yeah, go to Trader Joe's and get some vitamins and avoid sugar, just sort of the blanket statement. So that didn't really help, but I knew I had this problem. And it wasn't until years later when I found longevity and got on all the 90 essential nutrients and cleaned up my diet and took out all the real pro-inflammatory foods and started to figure out how to manage stress, did I start to see the light. Did I start to get some energy back. And then when I started to see you and you're like, yeah, well, you need this herb, and and you started to give me some lifestyle tips, which increased my sleep. So you caught me at the point where I was just starting to get better, but I still had exhaustion all the time, and it amazed me that one of the symptoms of that comes with all the symptoms of chronic adrenal fatigue is brain fog.
Yeah.
Just can't even focus, can't even sometimes I couldn't even understand people. It was just like Charlie Brown's parents going wah, wah, wah. It was just that immense amount of unclarity and brain fog. So how do we get to the point where we can start to get our brain back? Because I think when we don't even have our brain, it's really hard to implement new lifestyle changes.
So what I do is I start with people, because you need to get results first. When people are not feeling good and not feeling capable, like they can, most people come to me because they're feeling desperate. And many people don't know what a naturopathic doctor is. They've tried other things and then they say, okay, this is my last resort. It's not always like that, but oftentimes it is for people who have never seen a naturopath. And so they're already feeling desperate. And so I don't necessarily want to say, okay, well, what you need to do is to, take some time for self-care, an hour every day, and do this biofeedback meditation, breath work, and walk barefoot in the lawn, right? They're just going to look at me and say, I don't have time for that, and walk out the door. And it's not going to help anyone. And so oftentimes what I'll do is I'll prescribe the herbs as well as nutrition. You mentioned that, your MD had said, well, you go buy these vitamins or whatever. And she was actually right. The nutrition is very important as well, not just for blood sugar control, but also for things like magnesium. People that have adrenal fatigue tend to be very low in their magnesium. It's used in over 300 enzymatic processes in your body. And so in terms of a nutritional protocol, adding in magnesium is something that's very important for that. B12 is very important. I mean, all these different factors are important. So the nutrition is a good piece as well. But it's challenging to be able to do everything at once. And so I'll normally recommend for people just a pill. And I say, well, we could do a tea, but you have to take the time to make it. And it's the most affordable way to do it, but you need to take the time to do it. And then to drink it. And most of the people that I see don't have that time. They just give me a pill. And I'm like, okay, here's your pill. And keep it in your purse, or keep it in your wallet, or keep one on your desk and one wherever, so you can remember to do it, because most people are fighting with the brain fog. They can't even remember to take their supplements or their medications or any of that. And so set an alarm on your phone, keep it next to your toothbrush, keep it next to the coffee machine. I'm not going to take away your coffee yet, although I do tend to recommend people try and reduce it, because using too much coffee as a stimulant is a little bit like beating a dead horse. You're going to force your body to go until it really gives out on you. And so we try and reduce that a bit, and coffee can be quite straining on the adrenals. So normally I'll recommend a capsule that has the herbs in it, has a little bit of the nutrition that's important. And when I hit it right, when I assess the right stage where someone's at, people get amazing results. People come back and go, oh my gosh, I can think, I have energy, I can see. And not every patient is a home run, and lots of times there's a lot of different factors that fit into it. But more commonly than not, with the adrenal support, I don't test too often anymore, because I could just tell by the story. You can tell where you're at. Are you anxious and struggling with winding down and maybe a little bit of fatigue? Are you just wiped out, or are you somewhere in between? I can piece together where they're at. I tend to just do the testing when I want to know things like, I wonder what your DHEA is, which is a hormonal precursor that can play a role with adrenal issues as well as reproductive hormones, because sometimes I'll supplement that as well. So if I'm thinking that person needs more than just the herbs, if they need something further upstream, then maybe I'll do some of the tests. Or if we've tried with herbs and it hasn't quite hit it, or if they're very information oriented. Some people just want to see. They want the numbers, and that's what they need to be able to say, yes, this is the plan for me. Because while I have had people come back and say, oh my gosh, this product was amazing. That changed my life. I'm feeling so much better. That's great. A lot of times with the herbs, it's tonifying. It's something that you do for like 3 months to really be able to notice a difference. And that's why I, as a physician, chart, because you might not notice if you're getting 3% better every day. But if I say, okay, well, are you still waking up feeling tired? Do you still feel like you need a nap? Is your energy still about a 4 out of 10, 10 being optimal energy? And then they go, oh no, actually it's a 7. Or yeah, I'm not waking up tired anymore, because people don't always track those things. So the over time is important to have that tonifying thing. So I want it to be easy, and I want it to be trackable, so that they'll know that they're getting results and that we're on the right course.
Yeah, they didn't wake up one day and just have adrenal fatigue. It was years of abusing their body that got them there.
Yeah.
Which in this society, it's what we're taught. I mean, we are taught to work really hard in school so you can get a good job, and work really hard at your job so you can afford all the luxuries you want. And then feel guilty about not spending enough time with your kids, so spend time with your kids instead of taking care of yourself. And it's just this rat race to retirement.
And that's, an important part of that as well, is with the, adrenal issues and cortisol and blood sugar makes it very difficult to lose weight. So that's something that I commonly see as well, is patients will come in and they're overweight and have adrenal issues, and their blood sugar is off and their cholesterol is off, and if they don't have metabolic syndrome yet, they're on the cusp of metabolic syndrome, which is a mainstream diagnosis of elevated blood sugar, triglycerides, cholesterol, increased waist girth is kind of the diagnosis for that. And so addressing the adrenal issues is often something that, another story that I'll see is someone will come in and be like, my diet's perfect. I'm exercising all the time. I'm doing everything that I should be, and I'm not losing weight anymore. And I've got another, 40 pounds to lose, or whatever it is, or 8 pounds to lose, wherever they're at. And if the adrenals are part of it, if they're not sleeping, they're not going to be able to lose weight either. And so all of these things, rarely do I just see someone and they come in and adrenal fatigue is the only part of the picture. There's always a bigger picture, and there's more, and that's why as a naturopath I want to get your whole history and find out what else is going on, and is part of what's going on for you also digestive issues that's causing inflammation, and that's part of the brain fog. Maybe we're dealing with adrenal issues and a gluten intolerance, a whole bunch of things, so it's piecing together an individual protocol that can be quite helpful. Now that said, there are some herbs that across the board in general are good for folks, and lots of multivitamins will just have them included as part of it. So it's not uncommon to see things like ginseng in a lot of multivitamins that incorporate herbs as well, because that helps normal cortisol levels, also helps with blood sugar. Rhodiola is another adrenal herb that I like, and that one is one that is safe for pregnancy and also safe for women who are breastfeeding. So almost all of my new moms, either first-time moms or more importantly, if they're on their third kid, right? Because then they've got years of tiredness and sleepless nights on them. I always say, okay, well, if you're starting to feel it, if you're either dealing with postpartum or just starting to feel fatigued and you don't have enough, let's get you started on some rhodiola. And so that's another really good, really safe one to have on board as well. So there's a lot of different ways to approach it, and these for the most part are very safe herbs to use that I feel very comfortable with recommending for people of almost all ages. One that to watch out for a little bit is licorice root, which is amazing. Licorice is one of my favorite herbs. I love the taste of it. It's good for the digestive tract. It's good for acid reflux. It's antiviral. It's the herb that's responsible for extending the half-life of the cortisol. It's incredible. And if you look at Chinese medicine, Chinese herbal medicine incorporates licorice in so many different formulas because it's incredible. So, but one of the things that does, because it stimulates the adrenal gland is responsible for producing aldosterone, and aldosterone is a hormone that's responsible for blood pressure regulation. And so some people, if they already have high blood pressure, licorice is something that could be problematic for them because over time it could gradually increase their blood pressure. But more often what I see is people with severe adrenal fatigue, they say, oh yeah, my blood pressure has always been fine. In fact, it's really low. So it's abnormally low, and maybe they get dizzy when they sit up really quickly or getting up out of a bath, and that's because of that lack of just the entire adrenal gland not functioning properly, and so the low aldosterone as well. And so those people, that would be an indication for licorice. A lot of licorice tea and licorice tincture and licorice in pills, and just as much as you can get, that would be a good indication for that.
The Good Herbs, Longevity has a line called Good Herbs, and they have a adrenal support tincture. And you said, yeah, this is good, take it. And I can't drink enough of it. It tastes delicious. It got the licorice. It has ashwagandha in it, or
I believe that one has ashwagandha in it. I'd have to double check. It's not, it's kind of a combination product of kind of that stage 1 and stage 2, I believe.
yeah. Well, I loved it, and I guess it's not normal that people feel good right away. Maybe it's psychosomatic, but for me, whenever I take it, I notice that it extends the half-life of my cortisol. I actually have more energy for the rest of the day. Not like hopped up energy like I would from caffeine, but
Yeah.
I am more awake for longer when I take licorice. So I take that herbal tincture from Longevity. I haven't tried it just on its own. I've just done it with that combination of herbs.
Yeah.
Um,
It's delicious on its own. It's great in teas. It's a great herb.
I should grow some out here.
Then we could do our next podcast and do a wild harvest.
Ooh, yes, wild harvesting. That's right. You took me out to my front yard a few weeks ago, and we harvested some
Nettles.
nettles,
Urtica dioica is the Latin name for that.
and it was delicious. We made a tea out of it.
Mm-hmm.
Yeah. So there's all sorts of things. Looking around my yard, there's all sorts of things we could harvest for medicine.
Yeah, and the nettles are a great thing for adrenals as well, just because of that mineral support, an incredible source of minerals, more nutritious than spinach. So all of that's important in terms of treating someone with adrenal fatigue, and that diagnosis of adrenal fatigue is one that really does incorporate the heart of naturopathic medicine, which is treating the whole person, because there's going to be multi-levels of nutrition and exercise and going back to where we started, this idea of, we were chatting about nature cure. A wonderful treatment for adrenal fatigue is doing contrast hydrotherapy, very stimulating to the adrenal glands. And so the way I like to do it, because I don't like to be cold, is I go into the sauna, and I have lots of northern people's roots, Native Alaskan roots and Russian roots and Finnish roots. So all my people come from the north. And all of those cultures have traditions of saunas or banyas. And so going in and doing a nice long sweat, getting nice and hot, and then you do the contrast. You jump into the frozen lake in Finland, or lots of the spas and saunas here, you'll notice that they have cold showers or cold plunges to do. Doing that several times is incredible for the immune system, incredible for the lymphatics, very good for the adrenal gland. The way that you do it at home is you do a nice hot shower, you get your body nice and warm, and then you do a quick splash of cool. So 3 minutes hot, 30 seconds cold, and you don't have to set a timer. It just means a long time hot and a short amount cold. On your back, kind of at the bottom of your ribs, is around where your adrenal glands are. They sit on top of your kidneys. And so doing that every day really helps, especially for people who say that they need the coffee. That's a great way to start off your day. And also, commonly people with adrenal issues are always getting sick. They're always getting whatever their kids had. And so that helps with the immune system. It helps with the adrenals. It's an incredible way to start off your day. And also, people that do that, like if they're going to do the cold shower, they're pretty committed to their treatment plan. I think there's a mental buy-in of, all right, if I'm doing the shower, I'm going to do all of it. I'm going to exercise. I'm going to, it's hard to wake up and do that in the morning. So.
And then spend the rest of your day abusing yourself.
Right. Yeah.
So it's like, start your day off right, and then you'll make better choices all day long.
Yeah.
Yeah, I actually do. When I remember to, I do the hot bath and then the cold shower. Do you just jump back and forth?
Yeah, just go back and forth.
Yeah, just thinking about how an MD would treat this. I mean, and you'd go in and you'd say, my cycle isn't normal. So
right,
then they
yeah.
get you on hormones.
Probably birth control, right?
And I'm really tired and I can't concentrate, so they get you on Adderall.
Or maybe test your thyroid, but just test the TSH, which is a thyroid stimulating hormone, not testing your levels of free T3 and free T4, which are the active thyroid hormone. And the range for TSH, there's a connection between the thyroid and the adrenal glands. So if one is under duress, the other one will work harder to compensate. And so frequently when I see patients who are kind of borderline hypothyroid, if their levels of free T3 and free T4 are normal, and it's just their TSH that's starting to get elevated, so maybe it's at like 3.5-ish, it's starting to get a little bit up there, I'll treat the adrenals, because it's possible that it's the thyroid overcompensating for the adrenals being overworked, or vice versa. Sometimes it's, you have to treat the thyroid and the adrenals together. And so many of those herbal formulations will work for both of those.
And then, of course, not being able to sleep.
Right.
So not having problems falling asleep, so they get you on a sleep aid.
Right.
Like Lunesta.
Yeah. And then you can't wake up.
And then you can't wake up, so they get you on, what drug would they put me on?
Well, I think it'd be the Adderall, right?
Okay, so get the Adderall, yeah, because then it kicks my brain to gear. Can't lose weight, so they'd want me on,
surgery.
Yeah.
Surgery.
Surgery,
Yeah.
remove my stomach, or just bypass it. Or now they'd put a balloon in your stomach.
Right.
Fill a balloon up in your stomach and leave it there, giving you the sensation of being full.
Right.
So at least they don't cut anything out. What other symptoms are there typically for chronic adrenal fatigue?
So then it'd be the anxiety piece. So maybe you get an antidepressant. Maybe you'd also be given some anti-anxiety medication, a little lorazepam for those rare occasions that you need it, or daily. So there's a lot of different things that this very simple, very common complaint could lead to someone having a lot of polypharmacy, lots of prescriptions with lots of side effects and problems.
Yeah.
So, yeah.
Yeah, it's just so sad that they're not looking to the root cause like you were trained to.
Well, and that's what's beautiful about what we're seeing change now, is so many more people becoming interested in holistic medicine, and that trend, both in terms of the increase of the naturopathic profession, but also you see a lot of different, more mainstream doctors. Even here in Washington State, we're starting to see integrative holistic wings in the hospitals, or NDs on hospital staff, and so that's starting to become more involved. Even one of the hospitals here I had heard was adding an oncology wing that included naturopaths and acupuncturists, because their patients were getting their chemo and then going to see alternative practitioners to deal with all the side effects of the chemo and driving all over town. So let's put everyone in one place and make it really easy, and have all the providers be able to talk together and work together to treat that person,
right.
and having everyone be able to use their unique specific training for that patient's benefit.
Or said another way, the hospital realized that they're missing out on making money.
Well, I think long term, the insurance industry, the statistics that I've seen have found that naturopathic medicine actually saves people medicine, or saves the insurance companies medicine, because while we tend to see our patients more frequently, in terms of maybe for a specific complaint, it doesn't escalate as much. Our patients get better and they improve and have less hospitalizations, less incidence of chronic disease. Our patients are healthier, and so they cost the healthcare system less doing preventative medicine. And that's what we specialize in, and that's what in our country there is a severe lack of primary care physicians. The family doctor isn't something that in lots of medical schools isn't even taught anymore. That doctor that takes care of you from birth to death, that doesn't happen as much, because there isn't as much prestige in it. It doesn't get paid as well for that. There aren't a lot of big donors training to start the new family medicine wing, and so that's something that naturopaths and a lot of nurse practitioners are stepping in to fill that role. And so especially with our training in preventive medicine, I think that's where we can really help people and prevent them from needing to escalate, needing to go to the hospital. Someone who's got adrenal fatigue in their 30s, we're preventing that person in their 50s from an extreme example would be, just extreme depression, and perhaps not able to function, being on disability because they have thyroid and thyroid issues and depression, and just kind of stopping. I see patients get to the point where the beginning was adrenal fatigue, and then they get a whole bunch of other illnesses and diabetes and all these problems. And so if we can catch people early, we can really make a big difference.
I just remembered another back between 2006 and 2008, right before I was told I had chronic adrenal fatigue. I just had a ton of symptoms. I didn't know what was going on. I had to go monthly to get on antibiotics. Monthly. I had this chronic infection that kept coming back in my throat to the point where I couldn't swallow.
Yeah.
It was so bad. And I know what was wrong with me, and I just plowed through because, I had a job, right? I had a job to do. I was a sales manager, and so it was just go, 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 go. Oh, I'm sick, need to go to the doctor and take some pills and keep working. And they'd give me this cough syrup that had pain medicine in the cough syrup just so I could swallow and breathe and keep going on with my day. And it was like 2 years of being on antibiotics.
Yeah.
And then when I, started to like look around going, hey, something's really wrong here. And that's when the doctor pointed to chronic adrenal fatigue. And right around the same time, my husband and I saw a documentary on eating organic. I don't remember which documentary it was, but I'm sure it's on Netflix. But it was a documentary that came out right around 2008. It was about why we need to eat organic. And that day we decided to go to Whole Foods from then on and shop the perimeter of the store. And between that and supplements, I did not get sick for like 2 years.
Yeah, that's a good point. Lots of times people don't realize how damaging stress can be on the body. And so an example would be, I was just talking with a colleague who went under an extreme stress and was telling me about that this person had developed ulcers, was worried that she was worried that she had developed cancer, and they experienced a seizure from stress, right? And when the stress had been resolved, all of these other things, she didn't have cancer, but just the symptoms. She's like, what's going on? I can't function anymore. And it was the effect of stress. And so while certainly herbs alone can't address that, it's a big part, and the lifestyle factors and all of those things. But it can make you really sick. It can make you susceptible to infection. I had seen quite a while ago now, I think it was a study through the UW, the University of Washington. I'm not certain, I'd have to look it up again, but it was with medical students during finals, and it was testing their white blood cell counts. And the gist of the study was that the white blood cell counts were so suppressed in these medical students during finals, it was comparable to late stage HIV patients. So people kind of poo-poo it a little bit. Oh yeah, we're all stressed. Yeah, do your job, go work, 14 hours to just power through it. But it can damage a lot of things, more than just your enjoyment of your day, but it could ruin your health.
Absolutely. I mean, it's just amazing. So we're here to get our health back. So for those who are listening, who have identified with a lot of the symptoms we've talked about, they can get on these herbs. They can seek a naturopath in 18 states or
Right.
a handful of provinces. Yeah,
and caution with that, it's in the states that it's not, naturopathic medicine isn't licensed through the state anyone can, in unlicensed states, someone can get an online certificate and call themselves a naturopath, or a provider can take a weekend course, a different sort of health provider, a chiropractor, and I love chiropractic medicine, or a medical doctor, and I have a lot of respect for medical doctors, but taking a weekend course doesn't make you a naturopathic doctor, or not at the same level of what my postgraduate doctoral degree for my level of intervention that I would do for patients. That level of training can be helpful, but people don't know. In the states where they don't know, they don't know that it's unregulated, and so you could be seeing someone that had no medical training and just took a weekend course and said, I'm a naturopath, and that's not the case. So you need to do your own investigation and make sure that you're seeing a qualified, well-trained provider, whether that's an herbalist, and you just ask them, and do you feel satisfied with their answer? And if you want to see a naturopathic doctor, make sure that they graduated from an accredited postgraduate degree from with this naturopathic medical degree. And so that's a challenge for folks. But in Washington State, we're licensed as primary care physicians, so the people in Washington are very lucky. They get to have freedom of choice for who they want to see as their provider.
I know of 3 colleges. I know Bastyr,
NCNM, which is in Portland. Bastyr also has a campus in San Diego. There is
the the Canadian College of Naturopathic Medicine.
Mm-hmm.
And I don't remember any of the other ones. That's really sad. That's really sad because we could probably name more medical doctor schools right now than we could.
It's probably my adrenal fatigue kicking in. I know there's two more on the East Coast, but off the top of my head, I can't think of them.
Well, I'm going to list in the show notes, I will put a link to the governing body of naturopaths website, so people can go and look and find a naturopath that's licensed.
The American Association of Naturopathic Physicians, the AANP.
Exactly. Excellent. And you can also go to learntruehealth.com, and in our membership, you can type questions to Dr. Megan.
Yeah.
You can always do that. And we have great information on our website as well. So, but take action. If you experience any of these symptoms, take action now, because it just gets worse from here.
It does. And sometimes all people can do is just, show up for an appointment. That might be all the action that you can take. All right, I'm giving it one last shot, but go see a naturopathic provider if you experience these symptoms. And or ask me on the website or whatever, and it's a long haul, but it's worth it, and it's so much better than suffering and not appreciating, being able to enjoy this short time that we're given here in this life. So being able to function and enjoy your life free from stress, or not free from it, but being able to appropriately respond to it without it overwhelming you or shutting down your day or whatever. It's a nice place to be.
When I started on the supplements, the really, really high quality supplements, before, like the night and day picture, this is back in 2011. My husband's over there whispering, 11. But in 2011, I could not get out of bed till 11 in the morning. And we both worked from home, so, we just stayed up really late working.
Yeah.
But I was just so groggy in the morning. And 5 days on the specific longevity supplements, I woke him up at 5 in the morning, just full of energy, going, oh my God, I can't believe it. And he turned to me and he said, I still remember it. He goes, who are you? You're not the woman I married, but I like you better. I'll keep you. But I don't know who you are. but this is good. I'll get to know you. I had so much more energy, like with the minerals and the vitamins, and of course the diet change, cutting out specific foods, the 12 bad foods. It was the beginning of the healing, but it was night and day. So yeah, you can see fast change, but it does, it's progressive, because it took you years to get here. It's gonna, who invented that saying that for every year you've been sick, it takes a month to heal? There was some naturopath, there was some old school naturopath that said for every year you're sick, you need a month of cure.
Yeah.
So if you've been doing it to yourself for 30 years, consider 30 months to get better.
For all my patients, I expect, I like to follow up, and if they're not feeling better within 6 weeks, if we're not trending in the right direction, then we change the plan. I expect people to start to feel better, not to be cured, but to start to feel better relatively quickly when they start with these life changes. Yeah,
and instead of having to get on, what do we name, like 7 drugs an MD could get you on? So, and a surgery. 7 drugs and a surgery, or some natural medicine and cold and hot showers, I'll take the cold shower. So, well, it was great having you on the show. Thanks for joining me in my backyard.
Yeah.
And since I'm talking about the supplements, if you're listening and you're interested in getting the supplements, you can go to takeyoursupplements.com. There's some great people that'll talk to you and help you order the foundation nutrition that is good for everyone, not just for chronic adrenal fatigue, but good for supporting every cell in your body.
Right.
So
laying a good foundation.
Yeah. Awesome. Well, thank you so much for coming on the show, and I'm looking forward to having you on again, because I want to talk about how to heal the gut, the gut flora, and what the heck is kombucha.
Okay.
Okay.
I love kombucha.
What the heck is kombucha? Okay, we'll talk about that next.
Okay.
So thanks for coming on the show.
Thanks for having me.
Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements, and to talk to someone about what supplements are best for you, go to takeyoursupplements.com, and one of our fantastic True Health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program.